Simplifying the patient journey. Clinical trials are crucial to the medical industry, but they only work if you have enough patients to participate. And if the participants are engaged and invested, that's when the magic happens. Parexel's Patient Innovation Centre keeps patients at the heart of the study, increasing patient involvement and reducing their burden throughout the process. The centre works to simplify the patient journey, resulting in reduced recruitment timelines, lower dropout rates, and enhanced study outcomes. It also means greater efficiency and lower costs. Let's take a look at the current patient journey. A patient hears about a study and decides that they want to learn more. When they receive the study information, it's likely to include a lot of complex medical terminology. If they get past this barrier and they also meet the eligibility criteria, they enrol in the study. However, for many, the realities of study participation can prove challenging. The cost of travel, time away from work or school, and the practicalities of fitting study requirements in with their daily schedule can often lead to reduced compliance or even dropping out of the study. For those that continue, the end of study can be a disappointment. Lack of access to study results and potentially access to effective study medications can understandably cause frustration and the feeling that there's no appreciation for their participation. Parexel's Patient Innovation Centre takes all of these issues and many more into account and uses patient feedback to empower patients to become active participants in the study planning process, simplifying the patient journey to enhance satisfaction and increase compliance with study requirements. The Parexel patient journey. Before the study begins, Parexel uses our innovative patient-centric protocol optimization approach to identify and address the burdens of participating in the study. We help design a protocol that, through a combination of web listening, patient and caregiver feedback, and expert site staff input, will optimize the experience for participants, leading to more engaged patients, lower dropout rates, and better compliance. During the study, we strategically select services that will enhance the patient experience. Depending on feedback from patients, we select the tools and services necessary to reduce the practical, financial, and geographic barriers to participation. This could range from simply enhancing the informed consent process to implementing a virtual study solution that incorporates elements such as home nurse visits, telehealth e-visits to reduce the number of trips to the site, direct-to-patient drug shipments, and our patient sensor solution that utilises wearables to remotely capture, transmit, and store data in a secure platform powered by the Perceptive Cloud. And, finally, as the patient's involvement comes to an end, we have a closure plan to help patients feel valued and to understand the next steps. This starts with trial result summaries written in terminology the patient can understand, and a thank you card to show appreciation for their efforts. We can also include ways to transition them to a post-study treatment plan. For example, in some cases, Simplifying the patient journey. Clinical trials are crucial to the medical industry, but they only work if you have enough patients to participate. And if the participants are engaged and invested, that's when the magic happens. Parexel's Patient Innovation Centre keeps patients at the heart of the study, increasing patient involvement and reducing their burden throughout the process. The centre works to simplify the patient journey, resulting in reduced recruitment timelines, lower dropout rates, and enhanced study outcomes. It also means greater efficiency and lower costs. Let's take a look at the current patient journey. A patient hears about a study and decides that they want to learn more. When they receive the study information, it's likely to include a lot of complex medical terminology. If they get past this barrier and they also meet the eligibility criteria, they enrol in the study. However, for many, the realities of study participation can prove challenging. The cost of travel, time away from work or school, and the practicalities of fitting study requirements in with their daily schedule can often lead to reduced compliance or even dropping out of the study. For those that continue, the end of study can be a disappointment. Lack of access to study results and potentially access to effective study medications can understandably cause frustration and the feeling that there's no appreciation for their participation. Parexel's Patient Innovation Centre takes all of these issues and many more into account and uses patient feedback to empower patients to become active participants in the study planning process, simplifying the patient journey to enhance satisfaction and increase compliance with study requirements. The Parexel patient journey. Before the study begins, Parexel uses our innovative patient-centric protocol optimization approach to identify and address the burdens of participating in the study. We help design a protocol that, through a combination of web listening, patient and caregiver feedback, and expert site staff input, will optimize the experience for participants, leading to more engaged patients, lower dropout rates, and better compliance. During the study, we strategically select services that will enhance the patient experience. Depending on feedback from patients, we select the tools and services necessary to reduce the practical, financial, and geographic barriers to participation. This could range from simply enhancing the informed consent process to implementing a virtual study solution that incorporates elements such as home nurse visits, telehealth e-visits to reduce the number of trips to the site, direct-to-patient drug shipments, and our patient sensor solution that utilises wearables to remotely capture, transmit, and store data in a secure platform powered by the Perceptive Cloud. And, finally, as the patient's involvement comes to an end, we have a closure plan to help patients feel valued and to understand the next steps. This starts with trial result summaries written in terminology the patient can understand and a thank you card to show appreciation for their efforts. We can also include ways to transition them to a post-study treatment plan. For example, in some cases, our managed access programme can help patients get access to treatments based on the ground of compassionate use. Parexel puts the patient at the heart of clinical development with our Patient Innovation Centre. For more information about how Parexel's Patient Innovation Centre can improve the patient experience, enhance study recruitment and retention, reduce costs, and deliver better data, visit us online at www.parexel.com/patient innovation. Simplifying
My name is Tom Edgar. I'm from Hoffman LaRoche, and we are a global biopharmaceutical company and diagnostic company that is taking a different approach, really, to the way we approach our medicines. And a number of years ago, we changed our corporate mission to doing now what patients need next. And it sounds very patient-centric, but when we actually started to ask employees, what did this really mean? We kind of defaulted back to sort of the things that we looked at in the past, which was really product-centric. And so we said, oh, we deliver products that patients need next. And it really wasn't forward-thinking in terms of what patients really do need next. So luckily, with the Canadian leadership's vision, we looked at this and said, going beyond delivering innovative products, we need to think about how we can actually deliver the best patient outcomes by being more patient-centric. And so as part of the theme of the meeting that we've heard, collaboration and co-creation is one of the things that is essential to do this. And so we collaborated with the Canadian healthcare community and with patients to understand what the future of healthcare was going to look like and what pharma would come to the table as a partner to be able to deliver on better patient outcomes. So what have we done after that meeting? Well, we've kind of reversed how we do our planning. As I said before, we were really, really product-centric, and now we've actually reversed this and we've become patient-centered in our product planning. So we actually involve Canadian healthcare practitioners and patients in our strategy and tactical meetings when we're actually developing our yearly plans. So before, that was all done behind closed doors, and we would roll out our newest brochures or our newest information. And so now what we're doing is we're inviting patients and patient organizations and healthcare practitioners in to help us create what this is going to look like in the future. Now, of course, you can imagine that when we bring all of those people into the room, the number of tactics or ideas that you get is absolutely massive. So we had to kind of come up with a way that we could have investment decisions on what we would do. And so what we created was this idea of the triple impact criteria. And so when we make our investment decisions, what we look at is what are the benefits to patients, what are the benefits to the healthcare system, and what's the benefit to Roche. So we can apply that filter, and I'll show you some examples a little bit later on of how we applied that. But to be honest with you, to implement this patient-centered approach, it's not as easy when you're in a very heavily regulated environment like the pharmaceutical industry. And so we absolutely need these checks and balances in place in terms of how we interact as a company with patients. So Health Canada and our own internal guidance or compliance rules kind of throw up barriers. But I think what we've been really good at is looking at not what can't we do, but what can we do. And so what we've done is we've looked at a number of different ways that we can actually unearth patient stories. And probably the most powerful way to do this is, for us, ethnography. So ethnography is a science grounded in social and cultural anthropology that really does deep dives into the lives of patients. And so we employed a cultural anthropology firm to actually go out, and we piloted this with one business unit in our organization, the hematology business unit. So we would look at what is the patient journey for a hematology patient from before diagnosis all the way to either remission or palliation. And so we employed we looked at approximately 12 patients across the country. Many of them were at the end stages, so we could actually go back and look at what it was like before and what their hopes and dreams and everything else were before they were diagnosed, and then we followed them through. Now, when I say 12, it was qualitative, not quantitative. So we're looking for the deep, deep insights that those patients have, and we can use other quantitative measures to validate whether or not these insights are exactly what we're looking for. So the next slide I'm going to put up is very, very busy at the end. What I really want to show is, from the ethnographic perspective, what is it and how did we get the insights? So it's really about the structure, not the little letters that you're going to see. So the first part here, the first part here that we want to understand is what are the stages of the journey. In general, patients kind of go through this, before diagnosis, treatment, and then maybe remission and retreatment. So we want to understand, because it is different slightly for every different therapeutic area. The next piece that we want to understand is who are the influencers along the various stages of that journey. Because those influencers along the way could come in to help us understand what things we need to deliver for people. The next stage is their experience map. And you'll see in the middle of that, there's kind of a flat line. That's the 0. And so there's negative emotions and there's positive emotions. So you can imagine when somebody's first diagnosed, it's very negative, and when they're told they've went into remission, it's positive. So we want to map that over the entire journey. The next piece is to take that map and actually put some words to it, and that's the mind state. What are they thinking? This comes back to the thinking, the feeling, so that we can take it back and we can think about how can we help. The last part is, second to last part is the stakeholders in the patient experience. And the little red dots there actually indicate that these were gaps. And so these are some of the things that we'll talk about in just a second in terms of insights that we had along this journey in terms of the patient journey. And finally, we turn this into implications. What does this mean for us, and how can we actually help the patient? So hopefully that gives you some context as to the rigor that goes into creating the patient journey. And I'm certain that there could be other areas, if you're looking at it from outside of the pharma industry, what areas you would look at as well. So out of that, we had 3 big insights that I'm going to focus on today. So number 1 is that new cancer patients retain little of their information when they are told that they're diagnosed. It's well documented. And so one of the things that through this collaboration that we were made aware of is an app. It's actually a Canadian app, and it's called NextJ Pro Health. And this app is a free app for healthcare practitioners to download, and essentially it's a teaching tool that allows them to have slides and infographics that break down patient information so that they can actually counsel a patient in the meeting. The neat thing is that they break it down into 2-minute sessions, 5-minute sessions, or 10-minute sessions, depending how much time you think you're going to have with the patient. As you can see here, there's an option to send stuff to the patient. So actually, the teaching tools that you utilize, you can email to the patient afterwards. Probably the most innovative thing out of this is you can actually record the conversation and send that recording to the patient as well. And I've heard of individuals within our own company who've said that they were caregivers with people in a meeting. They heard the information, but the patient didn't. So to be able to go back to that recording and listen to it and say, no, the doctor did say, is a very beneficial tactic. So just to give you an idea, there are 2,000 Canadian healthcare practitioners who've downloaded the app. Interestingly enough, highest representation is from Quebec. So there are 800 healthcare practitioners in Quebec, and information is fully bilingual. So this was one thing that we looked at and said we need to provide a grant to be able to get hematology information in here that hematologists or oncologists can use with their patients. The next step, patients are turning to the internet to support their understanding of their diagnosis. And why? Well, because there's knowledge gaps. And it's, basically because patients have preferences, and in that time, we may not be able to address their specific preferences. So they're going out and they're learning. And so this one we haven't operationalized yet, but we're looking at doing it, where we're going to create so CLL is chronic lymphocytic leukemia, and we're using that to create a navigator where people can go online, do quizzes, and get information that now they can go back and have those conversations with their healthcare providers. The final insight was that there's little or no information for blood cancer patients in between treatments. So they go into remission. When they're diagnosed with leukemia or lymphoma, a whole network of people surrounds them and they're supported. And as soon as they get that all clear, you're into remission, that network evaporates for many patients. And so they said they felt alone and they didn't know where to turn. Lymphoma Canada was working on a portal for patients that were in this exact situation. Now this is one where we look at it and say, these are patients who've already been on our drug, they're doing well, they're coming off. And so if we look at it from the investment criteria, it makes sense for patients, and it makes sense for the healthcare system. Patients have already been on our drug, so we're not going to get anything else out of this, but it makes sense that we would invest in this because along the patient journey, we need to really support the people along this way. And they're in remission, so it certainly is something where they can now go and build community and get the answers that they need. So looking at our journey in terms of patient centricity, I think we've really gone from in the past where we were really focused on only when a patient was sick, and now we're looking at their entire journey knowing that they are a person more than a patient. And in the future, hopefully we can take the insights that we've generated in our individual therapy areas to try and come up with trends in general that will actually help patients moving forward. That, thank you very much.
Hi, my name is Stefano. I am a design strategist and online trainer and facilitator. In this short video, I want to introduce you to the impact of strategic design in healthcare, and particularly focus on the patient journey mapping, which is a tool that we use in order to step out of our shoes as healthcare providers and focus on the experience of our patients. Okay, so let me tell you what are the 4 points that I want to make in this short video. First of all, I want to give you a very brief introduction on the impact that design can have in healthcare and how we can become more patient-centric. Second, I want to show you very briefly the design process and the different tools that we can use in becoming better designers. Then I want to zoom in into the patient journey mapping and show you how it's possible to document the patient current reality and experience. And then let me close this video giving you kind of an introduction on how it's possible to develop the mindset of the designer. Okay, so let's get started with the first point. What is the contribution that design can bring into healthcare? And to me, the biggest challenge in there is actually developing a patient-centric approach to healthcare. This means that we need to shift away from our job, the understanding of our job as providers of a cure, in many times can be a medicine, to start understanding the root cause that many times are behavioral that generate that disease. In so doing, we open up new possibility for value creation for our patient, which also implies the possibility to prevent that disease in the first place. So let's move to the second point in this video, which is introducing the design process and its tools. Now, there are many different frameworks that we can use in order to organize a design project, but in this presentation, I wanted to boil down to the main 4 steps of any design process. Now, the first step, which by the way is also the most overlooked step in design, is the observation phase, which forces us to step out of our shoes and looking at the behavior of our patient in their natural environment. In so doing, we open up the possibilities for the intuition to tell us or to inform us of new opportunities for value creation for our patient. After having collected some observation, we move towards the ideation phase. That is where we start to collectively generate some concepts or possible solutions for our patients. After that, we start the 2 most famous or well-known part of the design process that are the prototyping and testing phase. And let me say that many healthcare providers, at some extent, are already familiar with prototyping and testing. In fact, they are already using a basic form of UX, user experience, and UI, or user interface. What the gap is left in there, though, is that while we are getting better at prototyping and testing new solution, new product, we are lacking in healthcare to strengthen our creative muscles that are needed both in the observation and ideation phase. In this third part of the video, let me introduce you to the patient journey mapping, which is a powerful tool that we use in the first step of the design process, the observation phase, that enables us to strengthen those creative muscles. Now, in order to visualize or to get started with the patient journey mapping, let me introduce you to an app that I use that enables us to move our creative effort, a team effort, from a physical to a digital space. What you see in front of you is a very large poster containing the different tools we use in the observation phase. For this video, let's zoom in into the patient journey mapping, which is, simply put, a process map of the positive and negative emotions that our persona is experiencing through the process. What is the first step in designing a patient journey mapping? Well, the first step is identifying which type of persona we want to chart out the journey mapping. And in this example, let's say that is a single mother with a young child. After identifying the persona, we need to be very clear on which experience we want to monitor. Here,